Good afternoon. I am Tara Register, a patient educator with the Stephen and Barbara Sloggy Mayo Clinic Cancer Education Program. I will be moderating this session. This is our part 3 of our 6-part series on survivorship. We want people on this webinar to know that this session is being recorded, so individuals who are not able to join us for this live session can watch it later. For those who would like to view this webinar again, the recording takes about 3 days to be edited and put on the video library tab of our cancer education group on Mayo Clinic Connect. Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect, get evidence-based information, and get access to information about classes and webinars our center offers. We encourage you to follow the Cancer Education blog on Mayo Clinic Connect so you can stay up to date on educational opportunities. We will put the link in the Mayo Clinic Connect Cancer Education blog in the chat. Now, as we're getting started, I just would like to make a quick announcement that we will also be continuing with our webinar series, the next being on Tools for Wellness Physical Activity on October 5th. We will take questions at the end of the session. If you have questions related to this webinar topic, please type them in the chat function at the bottom of the Zoom screen. I will now hand it over to Angie Murad, one of our very own patient educators.
Thank you, Tara. Thanks, everyone. Good afternoon. So let's go ahead and get started. So just to let you all know, so this information is in the webinar is not intended or implied to be a substitute for personal medical advice, diagnosis, or treatment. So we just want to make you all aware to always work with your physician or other healthcare provider when adjusting any medication, supplements, or making any lifestyle changes. So just wanting to put this slide up to make sure and be consistent that you check with your medical provider or your care team. So first of all, I'd like to just define what, with this webinar series, how we're defining or what it means to be a survivor. Not everyone who has or has had cancer uses that word to identify, identifies with that word survivors. For some people, this term might feel right. Other people just feel different with defining themselves as a person who has had cancer, a person living with cancer, or another way. But the term cancer survivor identifies a community of people with a history of cancer, either at the time of diagnosis, during, or after treatment. The effects of cancer do not end when treatment ends, as many people describe. So people with cancer are living longer due to improved care, screening, and newer treatments. So we feel it's so important to do this webinar series to talk and touch on all of these different topics. But we feel that too, it's important to be able to explain and discuss your medical and emotional needs with your healthcare team and as well as with your loved ones. So we really just want to be able to define this term. And then we also want to make it clear that in this webinar series, we're using this term cancer survivor to identify someone who has recently completed treatment. But it doesn't mean that the information that we're going to provide on this webinar and other webinars within this series will not be helpful. So it really depends on the topic that we touch on. But we just want to make sure that's to define this term and also make sure that this that we're clear with the term so that that information can be applicable more during the phase of after treatment, after that active treatment. As Tara had mentioned, we're all located as patient educators in the Stephen and Barbara Sloggy Cancer Education Center, and we do work with patients here at Mayo Clinic at all enterprise-wide sites of Mayo Clinic. But we feel that it's very important to also reach out to community members and provide these resources and information on all of this webinar series. And Mayo Clinic is a comprehensive cancer center, so it's a National Cancer Institute designated 3-site center that's dedicated in improving the lives of cancer patients and the community as well. So we're located here in Rochester, Minnesota, but we're dedicated to providing the most up-to-date education and resources to empower cancer survivors to be active partners in their health journey and even beyond their treatment. Tara had mentioned that she was going to put in the chat this Mayo Clinic Connect link to you all. And as she had mentioned, it's a digital platform, and we really want you all to, if at all possible, to follow our cancer education blog so you can get the most evidence-based information. As well as our classes that we provide and these webinars. And we record all of these and put them on our video library tab, which is located under the More tab. So you can, if this time doesn't necessarily work for people or friends that you think might be wanting to watch this, we put the video recording on the video library tab. So this survivorship series, we've already done 2 so far, and now we're doing the tools for wellness, healthy weight, and healthy eating. And as Tara mentioned, also going along with that topic, that's why we put it next, is the tools for wellness with physical activity. So let's get started. A lot of information that I shared with you prior even to getting started with the webinar. So our learning objective for today is to understand what type of eating pattern is best for cancer prevention as well as cancer recurrence. And I really want to also stress that I've put throughout the slides that I'm going to present today some strategies and resources to assist you in making sustainable dietary changes. If we think about it, dietary changes are difficult to make. If you think about it, obviously we've been eating all our lives and it's hard to make those changes. So I've really tried to put some strategies and experiments, and I'll talk to you a little bit about what that term experiment would mean on how to make small incremental changes to have a big impact on your overall health and things that can also be sustainable for you. I always like to start my nutrition presentations with just talking a little bit about nutrition research and sometimes why the things that we see in the press can be so confusing, and why, especially when we want to take control over certain types of things, we've had to kind of give up a lot of the control during our cancer treatment. And as we move from active treatment to survivorship, nutrition or physical activity or any lifestyle change is one area that we can really feel like perhaps we can take some control over it. But what we see in the press is often so confusing. We see conflicting information. We don't know what eating pattern is best for cancer prevention. Should I eat certain foods or avoid certain foods? Should I take a supplement? So we really I want to clarify with a little bit about the nutrition research, just to kind of go a little bit into that. And research shows that the same evidence-based guidelines that prevents cancer also prevent against its return. Making dietary changes offers a big bang for your buck because it can not only protect against certain types of cancers, but also serious illnesses like heart disease, stroke, and diabetes. And then I wanted to touch on, like I said, about nutrition research. So nutrition science really is a rather newer part of science in that it really began in the pre-industrial time when nutrition science was really correcting nutritional deficiencies. We would look at what types of things people were missing in their diet, and then add them to the diet. So certain type of disease like anemia, goiter. So maybe people didn't have enough iron in their diet or sodium in their diet. So then we would add those things and it would correct the deficiency. So it was really kind of easier to diagnose what people were missing in their diet and then correct it by eating certain foods. And then the condition was resolved. But now it's a little bit more complicated. Today, our greatest health problem is related to overeating. Not always, but often. People are consuming too many calories, what we call nutrient-dense foods. So they're just really high in calories, and too much low-quality food. So they bring on some of these chronic diseases like cancer, obesity, diabetes, and heart disease. So unlike correcting some of these diseases I had mentioned, like anemia, these illnesses are much harder to get a handle on. So they don't just appear overnight. This happens due to eating habits that we've followed maybe for many years. And so even over a lifetime. So it's fixing them isn't just a matter of changing one thing in our diet. So what I really want to emphasize is that sometimes the research can be conflicting because we really need to look at, often the research is looking at what people have been eating, what they've recalled that they're eating. So I don't know if you're like me, often I find it difficult to remember what I ate 2 nights ago for dinner. So that type of research where you're kind of going back and asking people what they eat, is probably the best type of research that we can do. The best research that I would say is taking groups of people and putting them into different eating patterns and making them eat a certain way for long periods of time. But that's expensive. It's really hard to do. And so that's why we have to kind of rely on people's recall, or observing what, or in other words, observing what people have eaten over a period of time and doing the best that we can in kind of teasing that information and coming up with what is the best eating pattern. And when I describe an eating pattern, what that means is typically what people eat over a long period of time. So that's kind of what I'm referring to. So we like to look at studies that have looked at people for longer periods of time, large groups of people, and observing what they have eaten. So I refer to a few studies in the presentation, and I'll talk to you about why they were a good study to look at. But the other thing too that I also want to stress is that often what we see in the headlines really is to catch your eye. And typically what is recommended is something in between. So it's not one type of food is going to solve all the problem nowadays with a lot of the conditions that specifically for cancer. So it's either, and foods are often deemed as good or bad. It's usually somewhere in the middle and somewhere in between. So often moderation is the key when we talk about what are recommendations related to preventing certain chronic diseases like cancer. So what I'm going to be talking about throughout my presentation are nutrition cancer prevention strategies that are recommended from the American Institute for Cancer Research, or AICR. And I put this as a resource at the end of my slides. But here are 7 nutrition-related cancer prevention strategies. There are other non-nutrition prevention strategies like physical activity. That's why we have that as part of the survivorship series, as well as not smoking. But in this presentation, I'm specifically focusing on these strategies. And with each of these strategies, I'll talk to you about why they're important. And then at the end of each strategy, again, I provide some ideas of some quote unquote experiments to try. I often like to pose it as an experiment because it's just like if you ever took chemistry in high school or in college, you did that experiment to see if it worked. Even if the experiment didn't work, that's okay because you learned something from it. So try something, see if it works, maybe tweak it a little bit, and see if it works for you. And that's really how you'll know if it works for you and be able to make a sustainable change. So these are only suggestions. You know yourself best on what might work or might not work. So let's get started at looking at some of these strategies. So the first one is strategy 1 is starting with a plant-focused diet. It doesn't mean that you have to be vegan, vegetarian, but as you can see on this plate, it's just really a plate that is focused on more plants. So the broccoli, the vegetables, the fruit. You don't see fruit on this plate, but you could certainly have a piece of fruit with it. And then having a whole grain. I'll talk a little bit about what whole grains are, how you can identify them. And then the other thing that I would focus on too, which I'll touch on another slide, but is also the portion sizes. So instead of having in your plate, meat be the center of your focus, really the plants are the focus. And I don't know if this is something that may be difficult for you. I mean, I grew up in the Midwest, so we often focused on meat as the center of our plate. That was often kind of where we started with meal planning, and what else am I going to add just as kind of like a little side. But really with their recommendation, it's really having the meat be less of the focus. So be a third of the plate, plants being more of the focus, being 2/3 of the plate. And then two, also addressing the size of the plate. So this is a 9-inch plate. Often plates are much bigger. So that's really where it's going to focus on our portion sizes. And that's also helpful to just keep all the food that we're taking in check, and helping with calories too. So the plant-focused diet, we talked about fruits, vegetables. Sometimes these are hard to find depending on where you live. Sometimes cost is a big issue. So one area that you could increase fruits and vegetables is if you have a garden at home, going to a farmer's market. Frozen fruits and vegetables, if it doesn't have added sauces or extra sugar in it, can be another way to get fruit or vegetables in your diet. And two, they don't spoil. Canned fruit is fine as well. It doesn't sometimes have as much fiber in it, but just if it is is a canned fruit, just want to make sure it's packaged in its own juice, 100% juice. And then it, like I said, it won't spoil because you just use what you need, and you can either keep the rest frozen or keep it in the refrigerator. With whole grains, to identify a whole grain, these are things like brown rice. Quinoa is a type of grain that is a little bit higher in protein. I will say though that quinoa can be quite expensive. Some people don't like the taste of it. So again, that could be something that you could try and see if that might be something you like. Whole wheat pasta. There's even some pastas that are even made with beans. So that could be something to even try. But it's just when we eat whole grains, it's going to have more fiber. The fiber helps move food through our digestive tract, so that has less exposure in the body of just things being broken down. It helps move things through the body. You stay regular, you don't have constipation. But one thing I will say too, whenever you increase fiber in the diet, it's also important to make sure you drink plenty of fluids and to do it slowly. If you don't have a whole lot of fiber by eating a lot of fruits, vegetables, whole grains, or beans in your diet, do this slowly, because it can really cause a lot of gas, feeling uncomfortable, and also making sure you drink enough water throughout the day. Beans and legumes can be a great way to add protein in the diet too, and it's not an animal source of protein. Also plants, when like these, will also include things like antioxidants, phytochemicals, which I'm going to talk about, and other nutrients too. And another bonus is that most plant foods are going to be low in fat. The calories, they don't contain any cholesterol. And then the only thing that I would just touch on a little bit with fruit is just to get it in the way of fruit itself, whole fruit, as opposed to juice. So for example, if you are going to drink juice, to make sure it is 100% juice, and keep the portions to about 4 ounces. The reason that I say that is if you use if you buy juice, it's just going to be more concentrated. So for example, 1 8-ounce glass of juice is equivalent to eating about 3 medium-sized oranges. Yes, it's going to be more nutrients, but it can also provide a lot of calories. And because it doesn't have a lot of fiber in it, it doesn't make you feel very full afterwards. So that's the other thing that I would say is when you include more plants like fruits, vegetables, whole grains, they have more fiber, so it sticks with you a little bit longer. And that also helps you eat less throughout the day too. So that's the only thing that I would say about fruit, is that if with juice, is that if you are going to have it, just make sure it's 100% juice and keep your portions to about 4 ounces per day. just because it's a little extra calories and we don't fill up on it. So I had mentioned about plant sources of like fruits and vegetables and whole grains. All of these have things called antioxidants in them. And antioxidants are certain vitamins or minerals found in these plant foods. And you can see all of the different kinds of fruits, vegetables, whole grains, and they have different types of antioxidants in them. And they are thought to prevent cancer and other illnesses because they prevent damaging chemical reactions in the body. So you can take antioxidant supplements, but what I would say about that is that because we don't know all the things that are packed in different foods, there may be things in these foods that we don't know about that really help the antioxidants do their work in preventing this cell damage. So in other words, it almost works like synergistically, or works together with other things in the food to help prevent this cell damage. And when you take it and isolate an antioxidant in a supplement, it may not do the work that it would do if it were just in whole foods. So, and for some people, if they are continuing on maintenance type treatment, it may block the properties of not helping with that maintenance treatment if you're taking any type of maintenance treatment for cancer. So not just me, but all dietitians as well as providers, we really urge, if you are thinking of taking a supplement, to really talk with your care provider about that, just because they can interfere and interact with some of the medications that you have, or if you are taking any maintenance medications. So phytochemicals, I don't know if any have heard about phytochemicals, but what that is referring to is the first part of that word phyto is a Greek word for plant. So phytochemicals are naturally occurring chemicals that are found in these plant foods. And they're found in fruits, vegetables, whole grains, and legumes. And there are thousands of them. So these are just a few examples. And I don't know if you noticed with the last few slides that I've shown, really these foods have a lot of color in them, not necessarily the cauliflower, but really hitting home the fact that you should really include a variety of fruits and vegetables. If you don't like fruits and vegetables a whole lot, try them prepared in different ways. So for example, if you don't like carrots raw, could you cook them? And then would you maybe like the flavor that cooking them brings out? So just think about trying them in different ways to also have you possibly like them in different ways of making them. So then the other thing that I would say is that these phytochemicals are thought to prevent or deter cancer because they also act as antioxidants. They produce enzymes which cause like chemical reactions that actually stop cancer causing compounds, and they may prevent cancer cell replication. So really trying to include them as much as possible in our diet is really helpful. And I don't know if you've heard the phrase eating the rainbow, really trying to include a variety throughout the day, throughout your diet is really going to be helpful. And what about soy products? Women with breast cancer often ask about the safety of eating soybeans or soy type foods. So soy is what is called a phytoestrogen, and we hear estrogen, and that kind of makes us scared, which is understandable if you've had a type of breast cancer that is responsive to hormone estrogen. So really, though, the phytoestrogen is a plant estrogen, and where the confusion comes is that estrogen can feed certain types of breast cancers, but they really act differently than the actual estrogen that women produce. It's different when it comes from a soy product. And some studies have shown that women who took soy supplements, so not just in foods, in soy supplements, specifically isoflavone supplements, had an increase in the cell in growth of breast cancer cells. However, several subsequent studies with just soy foods have proven that soy foods are safe and may even be beneficial for women with breast cancer in the amount of about 2 to 3 servings per day. So it can lower the risk of colon cancer. And they're also a great source of protein. That fiber is going to keep us satisfied longer so we don't feel like we need to eat as often. It also provides other nutrients like magnesium, calcium, and they also have healthy fats, and they contain those phytochemicals that I mentioned. And then I even put what are examples of a serving. So a cup of soy milk is an example of 1 serving, a half cup of soy nuts, shelled edamame, a half a cup is equal to 1 serving. And then with tofu, that can be a little bit tricky, but 1/3 of a cup or 4 ounce by weight, or 1/4 of the block if you're using like more of a firm type tofu. So that's also something that, again, would provide protein, a good source of protein throughout the day. So it could substitute just animal sources of protein. So here's where I have that application slide, or kind of like the experiment. What could I do to try to have a more plant-focused eating pattern? Just trying to eat 1 more servings of fruits or vegetables per day. If you find you're not eating a whole lot throughout the day, just start there. If you're doing a pretty good job, maybe you want to improve, maybe looking at each meal. Do you have a fruit or vegetable with each meal? Can I reduce my meat serving in a stew that I'm making, or add more vegetables to it? Or maybe adding beans too. Eating whole grain bread instead of white bread. So to identify a whole grain, you can, sometimes there's a whole grain stamp on a front of a product. It's like kind of an orange stamp that's from the Whole Grain Council. So that's one way to identify a whole grain. Another way to identify a whole grain is if you look on the ingredient list and it says 100% whatever type of grain, like whole wheat. It would be one example. If you don't like the texture of the whole wheat bread, some can be quite dense and might be difficult to tolerate if you're used to eating white bread. There's whole white wheat bread that has the texture of white bread, but it uses white wheat that is a little bit not as dense as other bread. So for example, if your kids don't like it, that might be a great place to start. And then even thinking about going meatless, like 1 dinner meal per week. And then 2, I also suggest, and I put this on the end of my slides as mayoclinic.org. If you go to our main internet page, you can search healthy recipes, and that brings up a whole list of different recipes. And there is 1 link that you can click on meatless dishes. So that might be a place to try, and to try something new and experiment with some of those meals. Okay, strategy number 2, achieving a healthy weight. Treatment side effects, possible changes in diet just due to treatment and lack of activity can really cause either unplanned weight loss or unplanned weight gain during active treatment. So where to find that happy medium of a healthy weight? We often use body mass index, or BMI, to kind of categorize people. I hate to classify people in certain BMI categories, but this is from a healthcare provider. And as a dietitian, we used to kind of have to categorize this because really, if you're too low, if you're underweight or overweight, or moving into the orange or your red categories with obese or morbidly obese, those can increase certain weight-related diseases and other health issues. So BMI is just a way to determine if you're at that healthy weight based on your height and your weight. The higher your BMI, your risk can go up with certain types of cancer, diabetes, heart disease, and other weight-related issues. I mentioned that. And excess weight isn't associated with every type of cancer, but it is associated with some of the more common ones like breast cancer, colorectal cancer, and advanced prostate cancer are just a few of them. And really, unfortunately, obesity is surpassing tobacco as the leading cause of some of these types of cancers. It's also linked to poor outcomes, including higher risk of certain recurrence of cancer and even death. So really, numbers are important, I will say, but there are other factors taken into account. So nutrition is all about the balance and making good choices 80% of the time. So again, that's where really looking at nutrition is a way to kind of take back some of that control on what it is that I can control, and make small changes. So just wanted to mention that a little bit. Okay. So really, what is the link with obesity, being overweight and obese in that category? It is, I have listed here certain type. You are more at risk for these 12 types of cancers. There's several ways that it can lead to cancer. And the reason is that the increases carrying excess body fat on our body increases hormone levels such as estrogen. And mentioned earlier, it can lead to certain types of cancer like breast and endometrial cancer. And fat tissue is really the primary site for estrogen production after menopause. So the fat cells also can produce a hormone called leptin, and high levels of leptin in our body promote inflammation, which we know is linked to certain issues like cardiovascular disease, heart issues, as well as cell cancer growth. So fat tissue is also responsible less responsive to insulin. And insulin is another hormone that brings, when we eat food, that food is broken down into sugar, and insulin actually acts like a key that takes that broken down sugar from any type of food and shuttles it into our cells to be used for energy. Because, or if someone has more excess fat, those cells will be less responsive to insulin. So, and then there's higher blood sugar, which then prompts the body to produce and release more insulin. So that just is like a cascading event of having more insulin in the bloodstream. So again, that puts us at, because of those high insulin levels, that can raise the risk for certain types of cancers like breast, prostate, and colon cancer. And what I do want to mention is that, yes, there is this link, but I want to also stress that really to emphasize that it doesn't have to be getting to your quote unquote ideal body weight, or even having to be exactly in that normal BMI range. Really, if we're just trying to work towards losing weight, that 1 to 2 pounds per week is really a great place to aim for. And after a diagnosis of cancer, it may help to prevent the recurrence by reducing those insulin levels, by losing weight. It may also decrease the leptin, decreasing the inflammation in our body. So it's important to note that not everyone who has a high BMI will develop cancer, but just kind of building awareness on why there is that link, and wanting to also kind of give some recommendations on how to work towards weight loss if that's something you need to do. So even, and I had mentioned this, even if you don't reach your ideal body weight, even just losing as much as 5 to 10% of your body weight can really have significant overall, it'll improve the quality of life, and it will also help physical functioning in cancer survivors, just increasing energy level overall, and it can decrease that risk for cancer recurrence or the development of secondary type cancers. And physical activity is also part of that, because, and that's kind of why we're going to touch on it on our next webinar too. So that's also part of that equation with helping with weight loss. So if that is something that you need to work towards and losing weight, again, kind of looking at your eating pattern. Do you have fruits and vegetables with your meals, one or the other? It doesn't have to be both necessarily, but are you eating them throughout the day? That can be a great way to add more fiber in your diet, so feeling a little bit more satisfied. Adding foods so you don't feel like you're deprived because they're just naturally low in calories. If you include whole grains or whole beans in the diet, again, increasing fiber, and not feeling like you're, with the beans, you would add some protein. And then also looking at what beverages you're drinking throughout the day. I had mentioned juice is one way, and whenever you're drinking beverages, it's different than eating whole foods. They don't fill us up. So are you drinking beverages that are contributing to extra calories? Portion sizes. So what size is your plate? Does your plate kind of look like that American Institute of Cancer Research, that 1/3 to 2/3 on your plate? And I even talk about mindful eating. That could be a whole webinar in itself, but just like, how quickly are you eating your meals? We know that when people eat at a faster rate, they tend to consume more food. So even just that might be something to kind of look at, how fast you're eating your meals and try to slow down. We know that with research, it takes about 20 minutes of your stomach to send signals to your brain that you're already starting to feel satisfied. So if you're eating at a very quick rate, you may not be sensing those signals that you're starting to feel satisfied. So if maybe you're noticing you're eating meals where you're not really focusing on your meal, maybe at work or at dinner time, it's just a quick, fast pace. And I'm not saying you have to do this at every meal. I get it. If you have kids or you're kind of busy with different activities, it may not be something you can always do, but it might just be something you want to practice and try and work with a little bit, to just consider that. And then also too, when are you eating? Are you feeling, are you using eating as a way to, if you're feeling anxious or if you're bored, that can be another thing that you can kind of look at to see if you're eating just out of certain emotional cues, because it can be just kind of a cycle, an eating pattern. So finding other things to fill the space other than eating, if that's something that you notice. And then food diaries or trying other things to kind of look at ways that you're eating, or going for a walk, deep breathing, or just doing things to distract you to deal with emotions, if that's something that you're finding that you're eating out of emotional worry or boredom. And then even considering a dietitian consult. If it's something that you've really tried to work on, and some of these things sound like things that you've tried, maybe just talking with a dietitian, kind of having a one-on-one to really talk through and look at your eating pattern. They might have some insight into giving you some ideas, or working together to collaborate and come up with solutions that might work for you, because together you know yourself best, and they have some of the insight with some of the nutrition. So between the two of you, you can come up with some great ideas. And this is just a slide. I'm very visual. I like to see different things, but these are two meals, and it's just comparing a calorie dense meal versus a nutrient dense meal. They're about the same amount of calories, but look how much more food you can eat on the slide, the food on the right. By drinking water, glass of water, no calories there. When you add more fruits, vegetables, whole grain bread, the soup has a lot of vegetables in there too, whole grain crackers. It's crazy how much more food you get on the right as opposed to the left. Not saying that you shouldn't ever have a hamburger or anything like that, but just, again, it's how often am I having those kinds of things, and wanting to try to incorporate more fruits and vegetables, and just realizing how much more food you can eat with and less calories too. Well, with treatment too, maybe you need to gain weight. You've lost weight due to surgery, treatment, a really complicated treatment process. So how can I gain weight? You can increase calories in a healthy way by adding their nutrient dense foods, so more calories, but also or not, they're calorie dense, but they also are high in nutrients. So things like avocados is actually like a fat source. It's a healthy fat, but can add extra calories. Dried fruit, adding nuts, natural peanut butter, healthy oils to different meals. Those can be some ways too to also add extra calories. If you feel like you're filling up quickly, your appetite is not very big, try to have more frequent meals throughout the day, and also separating out your fluids from your meals so that you're not filling up on, when you have the fluid as well as the meal, that can really fill you up. So separating those out can help make sure you get good adequate calories, protein, and then also making sure you have good hydration throughout the day too. So again, the frequent meals throughout the day, you just have small frequent meals, getting enough calories in to get that weight up too. So in order to achieve a healthy weight, again, just a few things I kind of talked about, but just looking at how big is your plate. If you really reduce your size of your plate, even just taking them out and measuring them, a typical plate that they recommend is 9 inches. So, and the other thing that I would say too, if you need to lose weight, is really being sensible, meaning that we don't want to cut out certain foods. We want to make sure we have that variety, moderation, so we get all the nutrients from different foods throughout the day. Another thing that I suggest too is keeping, like, if you feel like you might want a second helping of food, often when I've worked with people before, is just keeping the food on the counter as opposed to on the kitchen table. It just makes you take a little bit of a pause before you go to get second helping of food to really ask yourself, am I still hungry? Or is this something that I've just typically done? And so I'll always get a second portion because that's just what I've always done. So just kind of, again, making you slow down, ask yourself, am I truly still hungry? Looking at the beverages you drink throughout the day, a lot of the coffee drinks, the juices or soda has a lot of extra calories. And again, it's not like solid food that's going to fill you up. Tracking eating on some food tracking apps like MyFitnessPal or Lose It, or just going old school, writing down foods to kind of possibly make you more aware of times that you're eating throughout the day, or are you eating enough throughout the day? And maybe then you come home and you're so hungry, you're overeating when you come home. So just things like this can be helpful in kind of looking at for yourself. But if you also want to meet with a dietitian, this could be a great tool to take with them and kind of look at your eating. And then track the time it takes to eat a meal. Can you eat a little bit longer or follow a more plant-focused diet? Because that's just going to be lower in calories. Okay, what about red meat and processed meat? The recommendation is to limit it. And what exactly is red or processed meat? So red meat is any beef, pork, lamb, and mutton. And the difference between lamb and mutton is just the age of the sheep. So lamb is going to be less than a year old, mutton older than a year, and other things like deer, elk, buffalo. So any of these are going to be considered red meat. Processed meats are any meats that's preserved by smoking, salting, curing, or adding any preservatives like nitrates or nitrites. Some examples are like sausages, pepperoni, bologna, ham, bacon are all examples of those processed meats. So what does the evidence say with these types of meats? Consuming high amounts of red meat and processed meat does increase the risk, or they found an association with an increased risk of colorectal cancer. And it doesn't mean that you can't have these types of things, but the recommended amounts, specifically with red meat, is to try to keep it between 12 to 18 ounces per week. And if we break that down, if you have about 4 portions per week of about 3 ounces, which is about the size of a deck of cards, that is still within that recommended amount. So again, it doesn't mean you can't have it, but just what is the recommended amount? And with processed meats, they're really recommending a limited intake. So really trying to just treat it almost as if it's like a treat when you have it. One thing that I would just say was a study done recently in the United Kingdom that was this year that looked at regular and low meat eaters, fish eaters, and vegetarians. And they found that the colorectal cancer risk was strongly associated with environmental, lifestyle, and dietary factors. We know that. But this study was fascinating in that it looked at 472,000 people over a whole decade. So this is, again, a big study over a long period of time. And what they found, or not what they found, but just to define what regular meat eaters were of processed red or poultry, was greater than 5 times per week. Low meat eaters were less than 5 times per week. Fish eaters never consumed red meat, processed or poultry, and vegetarians never consumed any meat, poultry, or fish. And what they found was that low fish eaters and vegetarians were less likely to have developed cancer than the people classified as regular meat eaters. The study even looked at the most common types of cancer being colorectal cancer, postmenopausal cancer, and prostate cancer. And this study did adjust for those lifestyle factors like that physical activity, alcohol, and smoking, so that they could really just look at the dietary factors. And they were associated with cancer, and the link did stand up between the less and lower, between the less meat eaters and the lower meat eaters, that they did have lower cancer risk. So the bottom line is we do want to try to keep within that recommended amounts. And that meat isn't the only factor. We know that the other things that we're talking about, by increasing plants, keeping at a healthy weight, these also come into factor. But this just emphasizes how keeping, again, moderation with meat can really be helpful in lowering our risk of certain types of cancer, specifically like colorectal cancer. And what is the link between this? Research over the years has determined that there's 3 chemicals in particular that raise the risk of this colorectal cancer risk. One of these chemicals occurs naturally in meat. It's heme, and that's the pigment found mostly in the red meat. So the others are added or developed due to a process of the meats. So for the heme, like I said, is the pigment. And then there are other compounds like heterocyclic amines and polycyclic amines. So HCAs and PHAs, I like to say, because they're long words. And those are just produced when the meat is cooked at high temperatures. So grilling meat over high temperatures, or smoking or grilling meats, also produces these types of chemicals as well. And lastly, nitrates and nitrites are added to keep the processed meats fresher longer. And those are considered to be cancer-causing compounds. So that's really where the whole link between really limiting or treating it like a treat, those processed meats. So all 3 of these chemicals can damage the cells in the colon, as well as in the rectum, our digestional tract. And they can accumulate over time. So the risk for cancer can increase over time. So the other thing too that I would mention, and this is a whole newer area of research, is that consuming large amounts of red meat changes bacteria in the gut microbiome. And essentially the gut microbiome is just in your intestine. There are just trillions of microbes. Some of them are healthy and some not so healthy. So what they're realizing is that when people eat large amounts of red meat, it changes the composition or the type of microbes that are in the intestinal tract. So, and some of those types of bacteria that are in there actually can cause inflammation. So again, that's a newer area of research, and they're even looking at that in many different other health conditions. But this is just another area that they're looking into. And it's quite complicated because there are so many microbes in the gut microbiome in our intestinal tract. But just want to make sure if you see anything about that, that's an emerging area of research. So how can we reduce red meat and processed meats? One recommendation is to marinate the meat ahead of time. So marinating meat just breaks down the protein in the meat, so you don't have to cook it as longer and at higher temperatures to soften the meat. So the way you can marinate meat is you really just need to use mixture of some type of acid, like a vinegar, a lemon juice, or wine, with different herbs or spices that can really enhance the flavor. Because often people say that they like the taste of grilled meat, but you can enhance the flavor just by marinating, and then you don't have to cook it for as long or as higher temperatures. And those compounds that I mentioned, the HCAs, PHAs, PAHs, are caused by the direct that searing of the meats. So really just lowering the temperature of the meats. And you could even also partially cook the meat in the oven, and then just do a short time on the grill will also reduce exposure to the flame. Keeping the meat portions to about the size of a deck of cards. And again, just focusing more on plant sources of foods. And then also considering things like those plant-based beans, legumes, like lentils, fish. I didn't really mention a whole lot about fish, but that can be another great way to get protein in the diet, chicken, so all kinds of things too, that you can also get protein, not feel deprived. Then the strategy of limiting sugar sweetened beverages and processed foods, those really seem like a no-brainer, but what's hard is that our food environment, it's so easy to find these types of foods. We want quick, easy options. They're quite inexpensive. So it's really unfortunate that our environment, the grocery store, places that we go to eat, really make these types of foods much more appealing because of taste. I talk about the taste trifecta, salt, sugar, fat. They make them very appealing. And then the other thing too is that they're so inexpensive. But when it comes down to it, these types of foods provide little nutrients. They're high in calories, low in fiber, so they don't really keep us full for very long. Often you find these types of sugar sweetened beverages, processed foods are going to be in soda, and they can lead to weight gain. So for example, the average American adult eats 17 teaspoons of added sugars per day. That's about 270 extra calories. So if we look at 1 teaspoon of sugar has about 4 grams of sugar and 4 calories per each of those grams. So about 16 calories in a teaspoon. And studies indicate that liquid carbohydrates like sugar sweetened beverages are less filling. I've talked about that. And then if you were just to drink 1 12-ounce can of sugar sweetened soft drink each day and not cut back any calories anywhere else, you could gain up to 15 pounds over 3 years. So it's just crazy how that adds up. And so really just thinking about, yes, processed foods may make it a little bit easier, but are there things that you could also use as processed foods? For example, cut up lettuce or different salad mixes, using tools in the kitchen that may make your meal prep a little bit easier, or meal cooking a little bit easier. But the thing is that the other thing, when we kind of change over to some different types of eating patterns, like again, more moving away from more processed foods, our palate changes. So over time, they've done research and noticed that people really are more sensitive to salt or sugar or different types of foods when they don't eat them as often. So your palate can change over time. Again, it's just making small changes. So the other thing that I would just say is that within our food environment, sugar is found in a lot of different things. So you need to be careful that you are almost like a detective in noticing that if sugar is listed as one of the first or second ingredients, it's going to have a lot of added sugars in it. So it could be listed as sugar, as cane sugar, brown sugar, honey, agave, cane juice, sucrose. Yes, honey is coming from bees, but it's still sugar and it's adding extra calories. So we just have to be careful especially if it's listed as the first or second ingredient. Processed foods are just going to, again, like I had mentioned, are going to have a lot of ingredients listed. They're going to have high amounts of sugar, fat, other types of things in them. And they just help extend the shelf life, which is good, but it's not so good for our health. So really just trying to find other ways to improve our health and try to incorporate moving more in the plant-based direction and relying less on some processed foods. So just really looking at where those processed or sugar sweetened beverages might be coming in throughout our diet, reducing the size, or it can be one way. Looking at, for example, a lot of the coffee drinks, people may be drinking a medium size. Can I go to a small? Can I have it less often throughout the day? So those are a few things experiments to try. Drinking water flavored with fruit to still provide some sweetness, but provided with natural sweetness from fruit. And then preparing, relying on some kitchen time-saving tools like crock pot, chopped up salad, to incorporate more plant types foods, but then relying less on processed foods that are going to have more ingredients in them. And then things like that could be a little bit more processed, like a rotisserie chicken, for example, where it's already prepared for you, but using it in a stir fry, that can really save time. But you could use frozen vegetables or instant brown rice. Those are things that are going to save time, that cut corners, but won't have an impact. They'll help your health and not cause issues with your health. The next recommendation is to limit alcohol. And there is a consistent link with increased cancer risk and alcohol. And studies have found a link between alcohol intake and the risk of getting a number of types of cancers, for example, breast cancer, colorectal cancer, esophageal cancer, liver cancer, mouth and throat cancers, as well as stomach cancer. And in people who have already been diagnosed with cancer, alcohol intake could affect the risk for new types of cancers. So really, the less alcohol you drink will lower the risk for cancer. And it really doesn't matter the type of alcohol that you drink. It's whether it's beer, wine, or distilled liquor. And I even have standard drinks that are defined at the bottom. And research shows that when you drink alcohol, your body is breaking it down into a chemical called acetaldehyde, which can damage cells in your body. And it can even prevent your body from repairing certain damage too. So it's really just important that and for certain types of cancers, there really is no safe alcohol that does not increase the risk, at least some types of cancers. For example, breast and esophageal. They really recommend less than 1 drink per day. And the take for the American Institute of Cancer Research is that if you don't drink, don't start drinking. And I think where we sometimes get confused is that alcohol, especially like red wine, has been promoted as helping with health, but that's more so with heart health. And even newer research coming out is starting to kind of not show that as much. So really the take is really reducing the amount of overall, limiting that alcohol intake. So how can we limit our alcohol intake? Reducing the size of a glass that's used. Often red wine is in some of those really big glasses, but you often think that you're getting more when you have a more skinnier glass. So some of those wine glasses that are a little bit skinnier and narrower will make our brain think that we're drinking a little bit more. So you can reduce the amount. And just, if you're in an environment where you feel you need to be drinking, adding seltzer to drinks to just reduce the total amount of alcohol. And then even looking at finding other ways to socialize. Sometimes it's just a matter of people that we socialize with. It perhaps may be a way to manage stress. So kind of looking at how alcohol may play a part in our life to help manage stress, or a way to socialize. So are there different things that we can do in our life to reduce stress, as well as finding other ways to socialize? Then the last strategy is getting nutrients from foods first. And supplements really don't offer cancer protection. It's really only necessary to correct deficiency. And that's when talking with your provider, do you have a deficiency? Then that would be a time to take a supplement, a vitamin or a mineral. And eating a healthy diet should not be confused with the intake of a dietary supplement. Again, unless you have a deficiency or your physician specifically recommends a supplement. And every individual's different overall, and research shows that supplements don't offer cancer protection or benefits for survivors related to cancer recurrence. So really just wanting moderation, eating a variety of foods, and so that you get protection that way from foods first. So again, eating a variety, they can't change the way, help you have a better diet just by taking a supplement. Again, it has that synergistic effect. There may be things in foods that we don't know that could really have health benefits. And if you feel too, with fruits and vegetables, you're just not liking a whole lot of them, try and prepare it in different ways to see if you can maybe like them, and things that you've never thought that you would like. So in conclusion, really, we just want you to think about your overall eating pattern. What types, am I getting a lot of fruits and vegetables? Am I even identifying whole grains in my diet? How can I identify them? Can I include more of them? And then maybe focusing on a couple of these cancer prevention strategies. I really think just tackling one or two of them is a great place to start. And then also too, healthy eating can look different for each person. You may hear recommendations from family, from friends on different things to lose weight. Really, the recommendation is just to include all foods in moderation, including physical activity, having a variety of foods, not excluding certain food groups, and perhaps even considering a dietitian consult if you really want to dig in deep and look at things a little bit differently and have a different perspective. And overall, we just want you to be gentle with yourself. Making dietary changes can be very challenging. It's something we've done our whole life. So trying again to just tackle one or two of these prevention strategies. So we just want you to not only, as you transition from that active treatment, we want to help cancer survivors not just survive, but we want you to thrive. So always wanting to emphasize that. Then I just want to talk about the resources. This is our phone number to our Cancer Education Center. So we're happy to help you with any resources if you're looking for that. Tara put the Mayo Clinic Connect link. And then here's some resources on the American Institute for Cancer Research, as well as Mayo Clinic recipes, just search that. And then a couple other ones on oncology nutrition, American Cancer Society, and then Cancer Nutrition Consortium. But what I will say is I will take all of these resources, I will put them on Mayo Clinic Connect. When I put that video recording, I will put it on Connect and have the list of these resources too. So rest assured they will be there. So at this time, I will take questions if we have any. So I apologize, I'm going kind of long.
Right. Thank you, Angie. So I do have a couple of questions. We'll start off with this one first. Are there any data on the effects of diet on suppressing cancers that are in remission and or smoldering?
Good question. I would have to look specifically on that. And I think the thing that we often find is that, yeah, I think I will have to look more into that specific question, because often there is conflicting research with general nutrition information and then specific types of cancer and what is the recommendation. So I will take that question, and then I will, if you want to put maybe your email, I can answer that and get back to you on that, or even put it on Connect. So that's another thing that I can do if you don't feel comfortable putting your email in. So good question though. Thank you.
I also have another. It says, how do dairy foods affect hormone receptor positive breast cancer survivors? Should they be avoided? Not sure how much you can speak to that, but I can say that with some of those pieces, they do recommend, because you had a hormone positive receptor with the breast cancer, and because with like dairy milk from cows, I mean, there are hormones in that kind of milk, especially if it's, the higher in fat, that there might be some sort of relation. There are just studies happening now in relation, trying to evaluate whether these are, some things that can maybe cause cancer or have it come back. So I think that would be more of a specific question to your provider in addressing that kind of issue.
Yeah, I mean, more so. So again, that's going to be, you can buy milk that is going to be hormone free. So if that's something specifically that you're concerned about, that could be one thing. The other thing, more so with prostate cancer, really, and with breast cancer, not as clear. So that would be something I want to circle back on. But I know specifically for prostate cancer, which again is more of a hormone type, really the recommendation is 2 servings per day of dairy products. And that really is, again, considered moderate amounts. For some people, that may be hard to do because they're so used to drinking dairy throughout the day. So again, that would be where you should probably look throughout the day and see how many servings of dairy products you're having and trying to keep it within 2 servings per day. But that's also going to be helpful for just making sure you get enough calcium throughout the day. So for adults, that should be a good amount.
Great. And then I have another comment here. I didn't see much mention of dairy. Where does that fall for someone postmenopausal and need information, need more of that calcium intake?
Yeah, so with dairy, again, like I said, more the 2 servings per day. And that would be something to go back to your provider, even primary care provider. Just the only reason I say that is because they can order tests for knowing your bone health. So, and that would determine if you have a deficiency if you're showing signs of, let's say, osteopenia, where you're having some bone loss, or if you have osteoporosis, that's further along, where you're actually really seeing thinning of the bones more so. So that's where it's hard to speak to you specifically, because your provider would know what your bone health is. And then based on how your bone health is, that would determine if you need a supplement or not. So that would be an area where I would want you to go back to your provider and know whether you need a supplement for that. And then you could always still stick with that 2 servings of dairy products for the day, and just supplement whatever else you need for good bone health.
Yes, I agree. Yeah,
Mhm.
that definitely with the supplements, you want to be especially careful especially, if you're looking into the calcium. There's other things that they have to take into consideration with your health overall when you're taking supplements, including the calcium. So clarify that with your physician, and they can prescribe you if you need that extra supplement. They can give you the right kind of dose.
Good. Good question.
All right. I am not seeing any other questions. So
Okay.
I would like to close out this session and let you know that once this webinar is ended, you will be prompted to take a quick survey. This information, this information from you is very helpful, as it kind of helps us let us know how we can create and do better for you when it comes to new webinars, new information that might be more of interest to you. All right, thank you.
Thanks for sharing, Tara, about the survey. I'm glad
You're
you remembered
welcome.
that. Thanks, everybody. And I will follow up with that question with the specific type of cancer. Thank you.
Thank you.